Rise and rise of data. That's one side of the pandemic we have all come across. The what, why, and how of COVID-19 cases, vaccination, life and work, the new normal. Everything has been sliced and diced for nearly 2 years now. As data trackers and dashboards gained prominence, they brought along many questions too. What's the relevance of so much data? How can it be used in future? What are the gaps that the data explosion has revealed? I'm Nivedita Mukherjee. I spoke to some of the top names who've been at the forefront of data generation and analysis. Faculty co-chair of Johns Hopkins India Institute and Deputy Director of the Johns Hopkins Center for Clinical Global Health Education, Dr. Amita Gupta.
I think COVID, among many things that have been unprecedented, is data and data analytics are added to that mix. We have seen literally more than 500,000 papers published on the subject every day in the newspaper. There's some headline across the world. There is data about everything from the economic impact of COVID to the sort of scientific discovery to, all of the social impacts it has. So there's just data flowing every which way you look.
So pre-pandemic and post-pandemic, do you think there is a different way that one will look at data?
Absolutely. I think when you have a crisis like we've seen in the past 18 months, you realize that things have accelerated. People have come together that had never come together before to sort of access data, make data available, analyze data, visualize data, use it for decision making. So I absolutely think there's been a dramatic transformation pre-pandemic to where we are currently with how we use data, how we access data, how we look at data.
Not just global agencies like Johns Hopkins, even Indian organizations were busy data crunching. Abhishek Singh, CEO of the government's citizen engagement platform called MyGov, had this to say.
The pandemic, we started getting numbers and the cases started rising up, and we felt that this is going to be as much as a health challenge as an information challenge. Because the first few days, I remember when we were brainstorming about how to do the communications from Ministry of Health, very little was known about it. And there were some things that needed to be explained. For example, the doctors told us that this virus keeps you asymptomatic. So asymptomatic was something that needed to be communicated, because people in India were not aware of what it means to be asymptomatic. Because if you're asymptomatic, you will feel that I'm fine, I'm good, I will move around. So that was needed to be communicated. And the second thing was that quarantine, like if you're tested positive, then you have to be quarantined. So I remember mid-Feb, in fact, I was asking my team, what is quarantine? So that time nobody knew what quarantine meant. Now, of course, it's a part of the lexicon and everybody knows what quarantine means.
Private entities too played a role. Sachin Taparia, chairman and CEO of Local Circles, a social network, doubled the number of surveys during the pandemic to focus on various aspects of life in this difficult period.
In February of 2020, we started hearing from citizens across the country about various concerns they had regarding COVID, and people were talking about how protocols were not being followed at the airport when protocols were actually introduced. So since then, we started conducting various surveys around COVID. And we regularly have been escalating them to the government, essentially. So that way they come to know of issues before they actually become issues.
So tell me, how many surveys did you do in 2020 and 2021 all put together?
So we have done, over 200 surveys in 2020 and 2021, north of 200. And a lot of our surveys, Nivedita, are really based on what people are reporting. So with COVID, a lot of people have been participating and raising issues actually. And therefore the lead actually comes from people, somebody raising an issue which is beyond just themselves and the broader community identifying with that issue. And then, we saying that, look, there is a lot of traction on this issue. So let us, take this up for a survey.
Leading business chamber, Confederation of Indian Industry or CII, was an essential part of how the government interacted with companies on issues related to COVID-19. Chief economist at CII, Bidisha Ganguly explains.
There are a lot of sectoral associations which give out data on their sector. The most important one among them would be the automobile sector, where we get data on the production, sales, and exports of all categories, including four-wheelers, two-wheelers, etc., and construction equipment. So that helps us assess the activity in different sectors, such as for mining, for example, construction equipment is very important, and as well as other logistics and movement of goods, as well as other categories, goods, shipment of goods.
Right. So when it comes to COVID cases and vaccine, has the private sector been involved in India in data research and data analytics?
Not to the extent that it would have been desirable. I think it's just the data released by the government which has been tracked quite widespreadly. And vaccines, it's entirely a government initiative, I would say. I'm not aware of any private sector analytics based on this data.
When you compare the West with India, is there any comparison to be made in this area?
So in general, the Western developed countries have much richer data. For example, very key thing is on employment and unemployment. You get weekly data almost on the number of jobs created. In India, that is difficult because large number of jobs are in the informal sector and it's difficult to track. But even there, I would like to point out the CMIE, which has taken this initiative quite some time ago of tracking employment and unemployment on a weekly and I think sometimes even a daily basis. So while earlier it was not being tracked so much, post the pandemic, I think everyone is looking at that data to compare and look at how rural, urban, what are the differences in the two areas in terms of employment. Currently, for example, we have seen a big decline in unemployment, but still it has not come down to pre-pandemic levels.
Going forward from here, how do you think all this data that has been generated in the past 2 years can be put to use? And is there any economic value to it?
I think there's tremendous economic value. So earlier we used to get just, the quarterly GDP and these very, the frequency of this data was not very high. It was spread out over the year. But these are high frequency indicators that have started being used a lot. And there is certainly economic value for policymakers as well. They would like to track how the economy is doing. Both fiscal and monetary policy can be modulated as per the performance of the economy. So it's very important for policymakers to understand what are the changes that are taking place in the economic landscape.
The man at the center of it all, Dr. R.S. Sharma, CEO of National Health Authority and CoWIN, the technology backbone for the vaccination process, talks about the massive data explosion in these times.
We are able to, because of data, we are able to do lots of slicing and dicing, gender-wise, vaccine-wise, AEFI-wise, adverse impact, which vaccine has more adverse impact than the others, stuff like that. So I think that kind of data availability has ensured a number of collateral benefits, number of side benefits besides ensuring a very, very systematic, delivery of vaccination.
Is there any quantum to it? How much of data has already been handled by CoWIN?
CoWIN has, as you know, CoWIN has done more than, I don't know the latest figures. Maybe I can just have a look at the dashboard. Thus far we have had 1.1 crore, 111 million, so to say, vaccinations. 1,011, sorry. 1 billion and 11
yes.
crores. So that's the kind of data which we have handled, and obviously each person's account. Suppose you got it done for your family members, 4 family members. Then obviously your phone has got 4 data points linked with it.
Correct.
And each dose has got those multiple data points. So for example, the attributes which we collect are the name, the gender, and the vaccination center, and the vaccine type taken, the date of the vaccine, and these are the details which are available, and who vaccinated, the vaccinator's name also. So that data point is each vaccination has, let's say, about 10 attributes. So you can imagine 1 billion multiplied by 10. So 10 billion attributes are there with us, and which we can, sort of slice and dice. So also, let me give you some interesting statistic also. That, we were, the day when we did 2.5 crore vaccinations last September, we were actually doing vaccinations at the rate of 100 vaccinations per second. 1,000 vaccinations per second. 1,000, not
1,000 vaccinations per second. Okay.
That was basically, put it this way, we were doing in 8 hours, if you do 2.4 crores, in 1 hour you do 30 lakhs average. I mean, yes. peak will be even more, but I'm just saying average 30 lakhs. If 1 hour 30 lakhs, then 1 minute 50,000. If 1 minute 50,000, then 1 second 800 plus. So that's the speed at which we were doing. So this is the scalability part.
As many parts of the world face severe COVID waves again, the data crunching machine will continue to roll. For how long? Nobody seems to know as yet.
If you like this video, share it and subscribe to Business Standard. For more news, views and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram and LinkedIn.